Hello, my name is LaShanette. I go by Law. So I'm presenting the perinatal RN portion of our interdisciplinary care plan. My focus was on Maria Rodrigues, who is a 32-year old and currently experiencing gestational hypertension, possible gestational diabetes, and several social determinants of health that impact her ability to engage in prenatal care. So, for the maternal assessment summary, Maria presents with a multi high risk finding. She has several ranges of blood pressures between 155 and 160 systolic, and she has headaches and trace proteinuria, raising concern for preeclampsia, glucose of 162 with inconsistent monitoring. She actually uses her daughter's glucose monitor, and she's had multiple missed prenatal visits due to transportation insecurity. She's Spanish speaking with low health literacy. She's experiencing food insecurity, unsafe housing with mold exposure, and high caregiver burden, as her husband was just laid off, and a lot of the child care responsibility is on her. So, my priority problems and SMART goals that I thought would be good was risk for preeclampsia. And the SMART goal is to maintain a blood pressure less than 140/90 over the next 2 weeks with no warning signs, and correct it with labetalol use. And then my second one was ineffective blood glucose regulation. And my SMART goal is daily fasting and post glucose checks with fasting of less than 95 and a glucose check of less than 140 within 2 weeks. And then my third priority is related to her social determinants, so ineffective health management. Within 2 weeks, Maria will attend all scheduled prenatal appointments and identify at least two transportation resources. And for my key prenatal RN interventions, my interventions focus on safety, education, and access. And it includes weekly blood pressure checks and symptom review, teaching correct labetalol use using Spanish language and low literacy materials, educating on preeclampsia, warning signs, and assessing glucose monitoring techniques with hand-on teaching. Urgent referrals for a dietitian and diabetes educator, as she missed her last appointment with the diabetes person. And then connecting Maria to WIC and SNAP for food resources. Ensuring the interpreter services is at every visit, and coordinating transportation through Medicaid rides and community health worker support. These interventions directly support maternal safety and reduce risk for both Maria and the unborn or the fetus. For interprofessional facilitator role, in regards to my section, since we no longer have a separate facilitator, each of us will be explaining how the facilitator role supports our parts of the care plan. So for the perinatal RN section, the facilitator role is essential for integrating maternal, pediatric, and social determinants of health data. Maria's hypertension and glucose control are directly affected by Sophia's unstable diabetes, Mateo's asthma, Elena's developmental delays, and the family's housing and transportation barriers. The facilitator ensures these connections are recognized and addressed. The facilitator also coordinates communication across settings, including for her OBGYN and maternal fetal medicine, since she's high risk, and the school nurse for the kids and the home visiting RN, and then incorporating the social worker and the dietitian, behavioral health, and the community health worker. This prevents conflicting instructions and keeps Maria and her family safe. The facilitator ensures cultural and linguistic alignment by reinforcing interpreter use, low literacy materials, and consistent messaging across disciplinary, so she doesn't have to worry about that, and everyone will be on the same page regarding her health and like what's going on in her life, which affects her health and her care. This is critical because Maria is Spanish speaking with limited health literacy. The facilitator will maintain continuity of care by ensuring missed appointments are followed up, transportation barriers are addressed, referrals are completed, and monthly interdisciplinary review occurs. This keeps Maria's care moving forward and prevents gap in care. In summary, my role as the perinatal RN focuses on stabilizing Maria's blood pressure and glucose and providing culturally appropriate education and addressing barriers to care. The interprofessional facilitator's role ties all of this together by coordinating communication, aligning interventions, and ensuring continuity across all disciplines.
All right, I will start next. I'm going to be talking about the role of the maternal child home visiting RN.
Sorry, I'm trying to get there. And I can
No
edit
worries.
whatever we need to.
Yeah, I'll restart once you open it up.
There you go.
All right. Hi, I'm Natalie, and I'm going to be talking about the maternal child home visiting RN care planning. So I'm going to review the care plan that I created for Elena Rodrigues from the perspective of the maternal child home visiting nurse. This is Elena. She's a 2-year-old patient with a diagnosis of developmental delay. She was born preterm at 34 weeks and has a history of recurrent ear infections. She is currently not up to date on her 24-month immunizations and has missed several well child visits. She's also experiencing delay in speech. One thing that really stood out to me is that Elena has been excluded from the Head Start program due to her immunization status. And this is important because it not only limits her access to early education, but it also reduces the opportunities for social interaction and developmental support at this critical age. From a family's perspective, there are several barriers impacting her care. The family has limited transportation, financial stress, and a language barrier. These factors are directly affecting their ability to attend appointments and access early intervention services. Looking at the cues, Elena has missed speech evaluations and her mom has expressed concern about her speech development. Her history of recurrent ear infections raises concern for possible hearing impairment that could be contributing to her delay. When I look at the bigger picture, she missed appointments, delayed vaccines, and exclusion from Head Start all point to a pattern of limited healthcare access rather than a lack of concern from the family. Based on this, the interdisciplinary team and I identified 3 main priorities. The first is delayed speech development, since early intervention is critical for long-term outcomes. The second is risk for infection due to delayed immunizations, which also affects her ability to participate in programs like Head Start. And the third is limited healthcare access to transportation, financial strain, language barriers, which is impacting all areas of our care. As a home visiting nurse, my role is to focus on assessments, education, care coordination, but this plan really depends on a strong interdisciplinary team. For speech delay, I would coordinate referrals to a speech language pathologist for evaluation and therapy. and an audiologist to assess for hearing loss related to recurrent ear infections. I would also support the family by teaching them simple language stimulation techniques they can use at home, like reading, repetition, talking through out daily routines. For immunizations and follow-up care, I would collaborate with the pediatric provider to get Elena up to date on her vaccines. This is especially important not only for the infection prevention, but also so she can re-enter programs and access early learning opportunities. To address barriers, I would closely work with a social worker or case manager to connect the family with transportation services and financial resources such as WIC. I would also involve interpreter services to make sure the family fully understands the plan of care and feels comfortable asking questions. An early intervention specialist would also be involved to support her overall developmental progress in the home and community setting. To evaluate if the plan is working, we would look for Elena attending scheduled appointments, starting speech therapy, and becoming up to date on her immunizations. We would also look for improvement in communication, increased family engagement with services, and follow up would include continued home visits, coordinating with providers, and reassessing barriers to make sure the plan stays realistic and supportive for the family. As the maternal child home visiting nurse, my role is not just to focus on the child, but on the whole family. This case shows how developmental delays are closely connected to social factors like access to care. By working as an interdisciplinary team and addressing both medical and social needs, we can help better support outcomes for Elena and her family. And before I finish, I also wanted to highlight the role of a facilitator in this case. The facilitator would help guide the interdisciplinary team to stay organized and focused on the family's needs. In Elena's situation, the facilitator would make sure that communication between the team members stays clear and consistent. This includes coordinating between pediatric providers, speech language pathologists, audiologists, social worker, and early intervention services. The facilitator also plays an important role in making sure that care plan stays family-centered. For example, they would ensure that the family's barriers like transportation and language are being addressed across all parts of plan, not just in one discipline. And another key role of the facilitator is tracking follow-up and making sure nothing falls through the cracks. This could include confirming all referrals are completed, appointments were attended, and services like speech therapy are actually started. Overall, the facilitator supports communication, accountability, and continuity of care, which helps the team work more effectively and improves outcomes for Elena and her family.
Sorry, it got messed up there for a second, and I just
Okay.
lined up there. Okay, so my name's John. I held the role as the school RN for creating care plan for Sophia and Mateo. Sophia is an 11-year-old. She's a type 1 diabetic with diagnosed ADHD, but no medications or anything to help her other than an IEP program. She was recently hospitalized for DKA from an illness. She is not up to date on her 11-year-old vaccinations. Her psychosocial history is new stress from grandmother moving away, the new baby coming. She's worried about her mom, and new strain on her family over insurance changes. She has frequent school absences because of her type 1 diabetes and the ADHD on how it impacts her daily routine. The primary concerns are poor glucose control, confusion about insulin dosing, and risk of losing insulin pumped due to them losing their private insurance. For her, the subject cues, sorry, states she's worried about her mom, parents unsure about the insulin dosing, which is one of the biggest concerns that they have if she loses her pump. And then obviously concerned about insurance and then missing school. She's a type 1 diabetic managed with a pump and glucose monitor. One of their biggest issues that they have is the glucose monitor loses connectivity to the Wi-Fi consistently, so they're not getting accurate readings. So her glucose pump is not giving the correct doses when she needs them. Um, she's currently on methylphenidate and is on her insulin pump. Um, so, as the school nurse, I am trying to understand what is going on and how we can help at the school and ensure that there's no issues there. One that we talked about is the insulin. It has become a huge issue for them and it's not being managed. And so she's missing many days from school. She's at a risk of infection due to her type 1 diabetes and also not being up to date on her vaccinations. And then her new psychosocial issues with the incoming baby, and worried about her mother's health. My number one priority to look at is the unstable glucose control. There needs to be education to the parents on the correct dosing for the medication, ensuring that she's not just getting her maintenance dose, but also when her calories are changing and her glucose is going up on how much to administer. Um, so for my SMART goals, Sophia will maintain glucose between 80 to 180 during school hours, at least 80% of the time within 4 weeks. Um, by doing this, the interventions would be to monitor her glucose consistently on her own, follow individualized diabetes plan, and keep emergency supplies available at the school and then teach the insulin dosing not only to her but to her parents as well, and then ensuring that the staff around the school understand what she is going through if she does lose that pump. The next would be to review her immunization record and ensure that we get her scheduled for the correct immunizations that she has, so that way it's not another issue that she has to worry with her type 1 diabetes. Um, and then for her social priority is screen for the emotional stress, refer to school counselor, and educate teachers about diabetes and ADHD so that way they can help with her emotional stress of it all. For take actions and responding with the interprofessional team, the biggest ones that we're going to have is myself. I need to work with her PCP to make sure that we have the correct dosages here at the school, as well as that we have a supply here just in case she doesn't have it and we need to drop her blood sugars. And then other would be getting to her I'm going to mess this up, endocrinologist to ensure that her diabetes care is sufficient and that we have updated numbers, and getting her A1C updated. So if she does lose this pump and she is having to administer her own insulin, that we have the most up-to-date dosages for her as possible. Talked about the PCP. The other thing that we need to do with the PCP is making sure that her immunizations are up to date. And that we will have to facilitate to make sure that we have those on file as well to understand what she's missing. The other interprofessional team would be for her ADHD. At this point, it's not managed correctly, and we need to ensure that it's not impacting on top of the diabetes issue. Um, and also with a psychologist, get them in touch with our IEP team because as of right now, the IEP that she's on is not sufficient for how many days of school she is missing in a row, up to months that she's missed this year. I talked about that. So
I think we could
Whenever,
just move into
yeah,
the
you already seem
interdisciplinary
to
if you're done
talked
with
about,
yours.
yeah, who like what the facilitator would do, and you talked about all the extra interdisciplinary teams, so I feel like that was covered, so we can just move into our group
I
part.
have one more patient I have to go over.
Oh,
Okay.
Yeah, I have two
Yeah, you can
patients.
just go over the
yeah,
next
just
patient and then
Cool.
we'll move.
So for my next patient is Mateo. He's a 6-year-old. He has asthma is his biggest issue when it comes to primary concerns. Psychosocial for him, it's just financial stress. He hasn't had a pulmonary function test to understand how much his diabetes, that is his sister, how much his asthma is affecting him. He is a first grader at this time. And for psychosocial, it's not really a lot that was in there about his. Obviously, there's going to be stress of a new child coming in, and I'm sure he's worried about his sister's illness and her being in and out of the hospital and missing days of school. But for subject cues, mother reports concern of mold, which could be affecting his breathing, obviously, if he has asthma. Parent expresses worry about managing asthma during illness episodes. Family may be unsure when to use rescue inhaler versus when to seek medical care, and then possible concern about medication access to insurance and financial changes. Um, for the school nurse, one of the big things that I need to worry about is making sure that we have rescue inhaler on hand for him under the correct dosage. So he's under 90 micrograms as needed 4 times, and then, excuse me, every 4 hours. And then for him, our biggest concerns are potential risk of acute asthma exasperation, risk for delayed or inappropriate response during symptoms, and risk for inconsistent medication access. Um, for my priorities, the first priority is asthma exasperation. Second is ineffective asthma management, and then family stress and environmental stress or environmental risk with the possible mold that's in his house. So for those interventions, we need to get a baseline respiratory status for him. So that way we know I can check his baselines. So that way, if we're worried that we may be looking more past just an acute asthma attack, that we can get him the medical attention that he needs. Um, and that way we can have that on file at the school as well. The next is the teaching of correct inhaler usage. The SMART goal for that would be that they understand the difference between an asthma attack and when to seek medical attention within 3 weeks. Um, I will assess what triggers his asthma and the medication use and symptom recognition. Um, the nurse will I will demonstrate proper inhaler and spacer technique and have the parent return demonstrate, and then connect the family with resources for medication coverage if needed. And then for the social priority, Mateo will maintain appropriate participation in school activities without signs of distress within 6 weeks. Um, for this, I think our biggest concern and biggest intervention is making sure that we have a spacer as well as inhaler on hand for him if this were to happen at school. Jumping into the professional teams, we don't have an asthma action plan on file for him. So we need to contact the PCP to ensure that we get that. Need to educate all the staff from the lunch ladies to his teachers, the people out at recess, that they understand the signs and recognizing when he needs to get that rescue inhaler. Um, the incorrect or inconsistent inhaler technique. It didn't say whether he had a spacer, and if he's not using a spacer, I mean, even adults with our lung capacity should be using a spacer to ensure that we're getting the correct dosage into us and not just into the back of our throat. So making sure that I'm teaching that, maybe link him up with a respiratory therapist and his PCP to make sure we get the um, spacer, the medication, then the respiratory therapist can also walk him through exactly how it should be used. Um, have the home visiting nurse look around for possibilities of mold and then reach out to a social worker if there is mold within the house or I mean, the home visiting nurse isn't going to be able to diagnose that there's mold in the house, but if it seems like there is, that we get a social worker and get public health in to evaluate the hazards that are there. Social worker, school nurse. Yeah, and then the last one would be the school counselor, is that if this is all new, and they haven't been dealing with it, us bringing in that his asthma may be a bigger issue, may cause more stress on him, and we want, and with his sister, I've seen it with my own kids, with what's happened with my son. My daughter thinks that she has to go to the hospital all the time because she coughed or something like that. So it could raise up his levels of stress. And so we want to make sure that the school counselor is checking in with him to ensure that he is getting proper care for his mental status as well. Yep. So then I guess we
Awesome.
can move into
Yeah,
how we did fill out the
yeah.
document.
Yeah.
So while you pull that up, now that each of us has presented our individual care plans, we're going to move into the interdisciplinary plan portion that we worked on off camera to start filling out the whole family disciplinary care plan together. And we'll just walk through how we completed this as a group. So those are our roles, and if you scroll down, so now that each of us have has presented our individual care plans, we're going to move into the interdisciplinary planning portion. So for this document, we worked off camera to start filling out the whole family interdisciplinary care plan together, and now we'll walk through how we completed it as a group. So, for the maternal side, Maria's top priorities are stabilizing her blood pressure, improving glucose monitoring, and addressing transportation and language barriers.
Yeah, and then for the school nurse, for the school age children, Sophia's unstable diabetes and Mateo's asthma were the biggest concern, along with missed school, overdue vaccines, and emotional stress.
And for Elena, the priorities were her speech delay, recurrent ear infections, and missed well child visits. We also identified family level social determinants of health issues like housing, food insecurity, and childcare barriers.
Okay. As a group, we agreed that our goals need to connect across family members. So, for example, Maria's ability to attend prenatal visits depends on the transportation, childcare, and the stability of her children's condition.
Right. When Sophia's diabetes and Mateo's asthma are stable at school, it reduces Maria's stress and frees her to focus on her own health goals.
And when Elena's developmental needs are addressed early, it reduces long-term caregiver strain. So our goals support each other across the setting.
Perfect. So, we also discussed how each discipline contributes to the shared plan. For the prenatal side, I'm handling blood pressure checks, glucose teaching, prenatal follow up, and ensuring interpreter services
And
are
then for
available.
the school nurse, my role includes managing Sophia's diabetes plan, monitoring CGM result trends, training staff on asthma emergencies, and coordinating vaccines and school attendance.
And as the home visiting nurse, I'm supporting Elena's developmental milestones, coordinating early intervention, reinforcing health education in the home, and helping the family navigate resources.
We also rely heavily on social work, the dietitian, behavioral health, and the community health worker and the interpreter services. These disciplines help address the root causes of missed appointments, food insecurity, and housing concerns. Oh, since we don't have a separate facilitator, each of us is explaining how the facilitator role supports our section. So for me, for the me as the prenatal nurse, um, the facilitator ensures communication between the OB and the maternal fetal medicine, the school nurse and the home visiting RN, social worker, and the dietitian. They help align education, ensure interpreter use, and keep care plan consistent.
For my section, the facilitator helps coordinate updates between the school, the clinic, and the family. They make sure diabetes and asthma plans match what the medical team is recommending.
And for my part, the facilitator ensures that early intervention, speech therapy, and pediatric follow-up are aligned with what the rest of the team is doing. They help prevent gaps in communication.
As a group, we agreed on shared follow-up plan. For Maria, we'll review blood pressure and glucose weekly, confirm prenatal attendance, and reassess the social determinants of health monthly.
I'll continue monitoring Sophia's CGM daily, tracking absences and coordinating asthma and diabetes plans with the family and providers.
And I'll follow up on Elena's speech evaluation, vaccines, and developmental progress within the next 4 to 6 weeks.
Perfect. So we also agreed on monthly interdisciplinary case reviews, so all updates from school, clinics, and home visits are integrated. So that's how we completed the interdisciplinary care plan together. We combined our individual assessments, aligned our goals, clarified each discipline's interventions, and created a coordinated follow up plan for the entire Rodrigues family.